Care for Aging Sisters Association Kenya, KASAK, is an organization that began back in 2022 under the initiative of the Association of Sisterhoods of Kenya through the Assumption Sisters of Nairobi. The program is funded by the Conrad N. Hilton Foundation, with its main goal being to help congregations take care of their elderly sisters who face different challenges while aging. Sister Agnes Umuyu, the program director, explains more about it.
Currently, I'm working as the executive director for this new organization, Care for Aging Sisters Association of Kenya. It is an association founded in response to a great cry and a great need for better management of sisters in their early years of sickness and even at the old age. We are glad to the Association of Sisterhoods of Kenya for having provided us with the possibilities to found this new organization. It is funded by Conrad Hilton Foundation, and they are our great supporters in many programs. They have supported us in education, they have supported us in many activities, and they have supported us even in the many trainings. But this is the first time we are concentrating on one question: where do sisters go after long years of services? And we are following a sister by sister, a congregation by congregation, assessing the needs, responding to those needs, and moving the sisters, especially religious major superiors, on a choice, on a policy, on a strategic plan for caring for their old and their sick sisters.
Prior to its implementation, 2 sisters were selected to be trained as trainers of trainers in taking care of the aging sisters. After the training, these trainers of trainers were expected to impart back the same knowledge to the sisters who are taking care of the aging sisters in different congregations across Kenya. Among the sisters selected to be trained as trainers of trainers was Sister Aquinata Lumili from the Congregation of Sisters of Mary Kakamega. She explains how the journey began.
We started this training in 2021, and it was an online training by the Avila Institute of Gerontology, New York in the US. In 2023, we were invited to go to New York in the Avila Institute of Gerontology, and we stayed for 6 weeks having the training hands-on. We were trained both in class and practicals. We visited many houses which the sisters have. They have 19 houses of the residents, and each house has about 300 rooms, and all of them are full of residents. It was a learning opportunity which was very good for us to learn about caring for the elderly, aged, and the sick, which has not been with us here, because for us, we've been caring for other people and not thinking of ourselves. So when we came back, now we are to impart this knowledge to other sisters.
From the 8th to the 12th of March 2024, KASAK held a Training of Trainers workshop at J.J. McCarthy Center in Nairobi, Kenya. The training brought about 22 sisters from different member pioneer congregations across the country. The sisters came to learn more about how best they could take care of the aging and sick sisters from their congregations.
At the moment, we are giving a training to 22 caregivers who are helping, and they are really learning a lot, so that they may be able to give back to their communities, to help their communities, to serve the sisters, the aging sisters and the sick sisters.
We want these sisters to understand how aging starts. We want them to know how the brain age, factors affecting brains, and how we end up with the diseases in the old age. We want the sisters to know what other issues contribute to aging that leads us to a disease called dementia. The sisters who are in the course are very impressive. They are willing to learn, and we feel when they go out, they are able to help the other sisters in their communities to take care of the aged and elderly.
Sister Mariana Mwikali, a staff of KASAK, explains what motivated KASAK to conduct the training.
After our field research and listening from the sisters what they would like, one of the needs we have found, a very urgent need, is the training on caregiving. We have our elderly sisters and also the sick, both young and old, but literally we have very rare or minimal knowledge on how to take care of the sisters. So therefore we have embarked on doing training to empower the sisters so that they can take care of the sisters with a lot of care, compassion, and the right way, and to improve the life of the sisters, making them happy, feeling loved after a long time of service on whose shoulders we stand.
The sisters present during the training explained how they benefited from the initiative.
I am a caregiver living in a community with the elderly sisters, and I appreciate so much the training that KASAK has offered this time. From this I have learned the new skills on how to handle the aging sisters, their needs, their desires, and also how to journey with them with patience and with care. I have also learned the dementia process, which sometimes I had not understood well why they behave how they behave.
I thank KASAK for this great agenda on the care for the elderly and the sick, an initiative that is quite remarkable and a need for our congregations, since this is the time I discover that the elderly, they need a great priority in our lives.
This training is giving me an insight, knowledge, and skills on how to handle our sisters in their aging state, in their sickness. Before, I've been misdiagnosing my sisters, but from the knowledge I'm now getting, I'm able to handle my sisters according to their age. From the behaviors, I can identify whether she's sick or it is the age that is catching up.
We are here in the courtesy of the KASAK, who have empowered us and enlightening us on how to take care of the elderly and the sick.
Besides the training, the sisters expressed some of the challenges they are facing while taking care of these sick and elderly sisters.
I've been facing a lot of challenges because it's not easy one person to handle 10 sick people. Sometimes even I feel I'm sick, more sick than them. Some other times I feel that I need more assistance even than them because it is really tiresome. You don't sleep there. Sometimes you have no time to eat, you have no time for yourself.
Some of the challenges that I face is especially when maybe a sister is sick and maybe I may not be able to understand, or maybe she's not open to say how she is or how the condition is. Sometimes maybe she will present something like food that she don't want to take that food. Sometimes there's some medicine she's supposed to take, but she'll say not at this time to postpone. So sometimes such are the challenges that I face.
Okay, the main challenge that we are facing is that, first of all, we are not prepared. Being a young congregation in comparison with the other old congregations. The sisters who are caring for the aged and the sick, they are also not prepared. And therefore, you find the facilities that we are using, they are not proper for the sick, for the aged and for the sick people. For example, somebody has a back problem, and yet you see the beddings or the room the person is in is not proper.
When I take our sisters to the hospital, mostly the medication is very high, and this challenges me to pay the bills. Some tests are very expensive, and so it challenges me and the congregation at large to make sure that each sister is given the needs that they have.
I'm working in the house of our hot sisters in Voi. We have 7 sisters, and we are 2 of them who are animating them. The great challenge I can see for now is the medication. We spend a lot in the medication, and so I'll say we are trying and we hope for the best.
And just how can CASAK come in to support its members? These are some of the wishes that the sisters had during the workshop.
CASAK can help us through empowering our sisters so that they have this knowledge and also the skills. Because in our congregation we have nurses and those who work in health facilities, but I want to believe that some of these skills they may not be having the knowledge. So if they can come in and help us in capacity building, it can be very good, and also to improve on our infrastructure so that we may have that place, conducive place that can be set up for our infirmary, and also a place where our old sisters can be taken care of.
Because we are putting up a house for the sisters, both for aged and the sick, as well as the rest. So we are hoping that when this house is complete, that CASAK would be able to assist us equip some of the areas like gyms and any other thing that they would be able to assist in at that particular time.
In our congregation, we have 18 elderly sisters. Currently, we don't have any structure for them, and we have been trained that we have to give them good shelter, good nutrition. So I urge the CASAK, if they may help us put a structure for our elder sisters.
I'd like to ask the CASAK if they can help us build the houses for the elderly people so that at least they can be taken care in one place, and in the convent also, so that they can talk to our superiors so that at least they can establish the home for the elderly sisters. Because you find most of the congregation, they don't have all the sisters and they don't have the houses for the elderly sisters. So at least that one will be a step, and it will help us to improve our care in helping the elderly sisters.
CASAK can really come and assist us, especially in improving our infrastructure and also educating many members also in the community so that they can be aware of caring of the sick ones and the elderly ones.
As CASAK moves on with its mission of supporting congregations in taking care of the elderly and sick sisters, this is what the sisters from different congregations proposed to CASAK as the way forward.
I propose that we caretakers be given more training to be able to deal with the challenges that we face each day, so that we can be effective in our ministry, and at the same time not only to look at us as religious, also to look at the people that we live with, we work with in our ministries, our neighbors, because caring for the aged and the sick is not only for religious, even for the laity.
So I encourage CASAK not to give up, but as they continue assessing how we implement the training that we have received, they also don't get tired to correct or to amend us here and there.
I encourage this CASAK to continue training more sisters in that training. And then not only the sisters, even the lay people outside there. We have elderly people outside there who don't know these things.
and we encourage the association to reach out even to those people.
Thank you.